Today we're shifting gears. We're looking at another really critical aspect of men's well-being, testosterone replacement therapy, TRT.
That's right. And there's a lot of noise out there about it. So our goal today is simple. Cut through that, get straight to the costs, the packages, what you actually get, give you the clear picture fast.
Exactly. So just to set the stage quickly, what is TRT? Fundamentally, it's a medical treatment. It's for men who have clinically diagnosed low testosterone.
And why does that happen? Is it just getting older?
Well, aging is definitely the most common reason. Testosterone tends to drop, maybe 1% per year, typically after age 40.
Okay.
But it's not just age. Hormonal imbalances can hit younger guys too, and the result is often that feeling of just running on empty, fatigue, low energy, maybe low libido too.
Yeah, I hear that a lot. The fatigue, the lack of drive. So TRT aims to fix that.
That's the goal, yes. The benefits people report are usually pretty significant. We're talking things like better energy levels, definitely. A mood boost is common.
Right.
Also, increases in muscle mass, getting that sex drive back online, maybe better focus, concentration, just feeling more like, well, like yourself again. That's why men seek it out.
Feeling like yourself again. That's a powerful motivator.
Yep.
Okay, let's talk dollars and cents then. Specifically for Orange County, what kind of price range are we looking at?
Generally, you're going to see monthly costs anywhere from about $155 on the low end up to maybe $420. It really depends on the package, how comprehensive you want the monitoring and treatment to be.
Okay, so there are different levels. Let's break those down. What's the starting point?
The entry level is usually called something like the Essence TRT plan. That one runs about $155 a month. Think of it as the essential monitoring package.
Essential. So $155 gets you.
Mm-hmm.
What exactly? What are they monitoring?
It covers the testosterone treatment itself, of course, but critically, it includes the core lab work for safety, so total testosterone levels. CBC, that's the complete blood count, make sure everything's okay there. CMP, the metabolic panel for kidney and liver function. Estradiol levels, too. And PSA for prostate health, if it's applicable.
Okay.
And those labs are done 4 times a year. Plus, you get a quarterly televisit with the physician. It's really the foundational care, making sure the basics are covered and you're safe on the treatment.
Got it. Foundational, safe. But what if someone wants more? More than just the basics? Maybe a wider look at their health. Is that the next step up?
That's exactly where the next tier comes in, usually something like the Elevate TRT plan. This one's around $305 per month.
Okay, double the price. What does Elevate add to the mix?
So Elevate includes everything in that Essence plan, but it broadens the view quite a bit. You start getting deeper insights into things like vitamin levels, cardiovascular health, even adrenal function.
Like what specifically?
Specifically, they add tests for DHEA, vitamin B12, and folate, which are all really important for energy.
Right.
And a full lipid panel, cholesterol, HDL, the whole breakdown. So the doctor isn't just managing the testosterone, they're looking at your overall health picture more proactively.
Okay, that makes sense. More proactive. Now, the top tier. The Thrive TRT plan at $420. That's another jump. If Elevate covers overall wellness, why go even further with Thrive? What's the extra cost buying you?
That's a really good question. Because Thrive is where you move from proactive monitoring to really optimizing the treatment. It takes everything in Elevate and adds some key markers that tell you how well your body is actually using the testosterone, like SHBG, sex hormone binding globulin.
SHBG, what does that do?
Think of SHBG like little taxi cabs for your testosterone. If you have too many taxis or they're too sticky, the testosterone can't get out and do its job effectively, even if your total level looks good on paper.
Ah, I see. So it's about bioavailability.
Exactly. Thrive also adds prolactin, IGF-1, which is linked to muscle building and growth hormone activity, and usually about 4 other targeted hormone or peptide markers, depending on the individual's needs. It lets the doctor really fine-tune things so you get the absolute most out of the therapy. It's for full optimization.
Okay, so it's about making sure the investment is actually working as hard as possible for you. Which brings up the big question, is TRT cost-effective? I mean, $150 to over $400 a month isn't cheap.
It's definitely an investment, but you have to weigh that cost against the potential benefits. When you factor in potentially better sleep, improved energy, better sex drive, easier time building muscle, just overall better bodily function. For many guys, the math works out.
The quality of life improvement.
Precisely. The real value isn't just the list of lab tests, it's the outcome. It's feeling better, performing better. And that often comes down to having expert guidance like the hormone doctors you find at places like Optimal Clinic USA here in Orange County. They focus on treating the symptoms, the whole person.
And that expert guidance is crucial, right? especially maybe for younger guys considering this. It's not just grabbing a prescription.
Absolutely not. A proper consultation with an experienced hormone doctor is essential. They need to look at your specific symptoms, run the right diagnostics, check your actual levels. It has to be tailored to you. It's definitely not a one-size-fits-all thing.
Good point. It's real medicine needing real expertise.
Definitely.
So wrapping up then, before starting, it's important to understand the costs and what each plan includes. If you're ready to feel better and take control of your health, TRT might be the right step for you. Need expert help. The team at Optimal Clinic USA is here to guide you.